I'm Russ Daugherty. I'm the health officer for the Rush County Health Department, and also a physician who's worked at RMH for about 20 years now.
All righty, nice to have you. I guess the big question that everybody is asking is, I guess, especially locally, how many people have had COVID?
Locally, we've had, well, just this month, we've had 174 people have had it just this month. I think we're over 500 people that have tested positive. And we've had 10, as of today, we have 10 deaths from it.
Wow.
The difficult part is that when you're measuring people that have it in any given territory or county, it's not just, we measure the people that live here. It's not all the people that have worked here. And so a lot of folks, most people that actually work in the factories and things in this area don't actually live in this county, so we don't track those numbers. So we've had a lot more COVID in terms of people having it and spreading it than that actually show on the numbers.
Okay. And then what about if you look at it from a bigger aspect, so just the U.S.?
It's when you do the math, if it's only, if it's only 10% of us that have, we estimate that 10 to 15% of us have had it. So you're talking about 30 to 40 million people in the U.S. have had it. And out of that 30 or 40 million people, we've had, 100 and some thousand deaths.
Right.
And so you can just imagine how many people, how much more in terms of death and hospitalizations we're going to have if everyone gets it at one time.
Right. And then along with people having COVID, I guess when we first found out about COVID, the symptoms ranged and people were confused to what, I guess, a COVID symptom was. So what is a COVID symptom that the doctors consider, and how long do you get to feel? Like, how long is it until you feel these symptoms?
It can be very difficult because basically, the COVID is a cold virus. It is, and most of us just get common cold symptoms with it. But there's a small, 10 to 20% of us progresses, gets deeper into the lungs, and causes severe symptoms. So the majority of folks are just going to have common cold symptoms. Most of them will have fever, sore throat. A lot of younger kids, especially school age, that 1 year to 10 years, they'll have stomach symptoms where they'll have more nausea, vomiting, diarrhea for several days. And they may never have any upper respiratory or cold symptoms at all, just be stomach symptoms. But pretty much right now, given we are in a pandemic, if you have any sort of cold symptoms at all, we want people to get tested. Right. If you have any sort of low-grade fever, any sort of symptoms, because most of what we're seeing right now is COVID, but we're still seeing a lot of just run-of-the-mill colds and strep throat and those type of things too. But a symptom can be, common ones are runny nose, dry cough, sore throat, fever, muscle aches.
Okay. And along with when we're progressing further into COVID, but when COVID was first introduced, we were informed that the elderly generation would have more of an issue dealing with COVID. Do you think that's still true? That
is still true.
Okay.
Well, I didn't answer the question about infectivity, is that the difficult thing about COVID is that it's very infectious. It's not very deadly except for a certain group. And so it's very infectious in that you guys get it. Most young folks get it and will not have any symptoms, or 40% of people that get it don't, at your age, less than 40 don't even have symptoms. However, if you have type 2 diabetes, or if you're over age 60, 10 to 20% of those folks progress where they need hospitalization, need oxygen therapy, and about 18% of those folks that get infected will end up needing a ventilator. And again, it all comes down to numbers. I look at it as a math problem. It's because it is a brand new virus. If you come in contact with it, you're going to get an infection. And if you start doing the math, we have 6.7 million people in Indiana, and if you do the demographics, if you take 10% of those that need hospitalized, it just overwhelms the hospital system.
Right. Speaking of the hospital system, how many people do we estimate or know have been hospitalized due to COVID?
That's, I haven't looked at the actual statistic. If you look at because because we're at a real peak right now. We got at least 3,000 people hospitalized as of today in Indiana. And if you look at the total numbers that have been infected, you are probably looking at 15 to 20,000 people just so far. But and again, if you project that forward, if you don't slow this down, you're talking about thousands more being hospitalized.
Do you feel like we have peaked, and then along with that question, with it being the peak of COVID, how will we know if we're in the peak of COVID?
It does come down to, it's very hard, the projection, the mathematical models are very complex, so it's really hard, the mathematical models are only as good as the information you put into it, and it's hard to get good numbers, but looking at the trajectory of how fast we're spreading right now, we won't peak, even though we're seeing, we're almost maxed out our hospitals in the city especially. We won't peak for another month and a half to 2 months.
Do you feel like pushing masks and having people wear masks as much as the guidelines recommend, do you think that is beneficial?
Masks are, there's obviously been some controversy over mask wearing and how effective they are. There's data, if you have everybody wear a mask, it appears to be very effective in slowing down the spread. It's not 100% effective, but you're talking about just a few percent chance of spreading COVID with you and I wearing masks. If I was positive, you'd have a 2 or 3% chance of catching it right now. Without a mask, it goes way up. And so the mask, if you don't have everybody wearing them, they're not as effective. A recent Danish study came out, and they looked at the population, half wore masks, half did not wear masks. And they found that the people who wore masks only had a slight decreased risk of catching COVID. However, when you take the entire population, it appears to be very effective. Because what we're seeing now, we're not seeing, obviously there's folks in the school catching COVID, but the percent that I'm seeing in the schools are way lower than what I'm seeing in the population. The biggest danger of catching COVID is when we go home, because everyone, for me, at work we all wear masks, but when I go home, my children are going to school, and so my biggest danger of catching COVID is actually my children at home.
Right. With if you just get on the news nowadays, and you can hear all about a vaccine, and I guess the big question is, when will that vaccine be available?
If it is approved, we hope it's approved actually in the next 24 hours. Vaccine has actually already been delivered to most states. And logistically, we have things in place that we will give the first vaccines in Rush County next Friday. So December 18th is when we're anticipating the first vaccines in Rush County. That's going to be for primarily healthcare workers, and then also nursing homes. We're going to start doing nursing homes initially. So we hope to have actually several 100,000 people in Indiana vaccinated by the end of the month.
With what we know about the vaccine, do you feel like it is safe for people to get and being willing to get?
The data we have right now is that we've had at least 40,000 people get these new vaccines, and we've had UK had 2 people had an allergic reaction, which is not uncommon with any medicine that you get, but most folks had just muscle aches, low-grade fever for a day or 2, and but otherwise they had a great response. They made what we call neutralizing antibodies. So it appears to be a very, very safe vaccine, and also appears to be a very, very effective vaccine. Okay.
And with the people are getting the vaccine, would you still recommend the guidelines that are being pushed with wearing a mask and staying 6 feet apart?
Yeah. The vaccine, we don't know yet if the vaccine is going to be will be such that we will not be able to spread it. Vaccines, typically when you have a vaccine, your body makes antibodies and things. You still may get an infection, but it won't cause actual disease. And then, so we don't know how infectious you're going to be if you've had the vaccine. You still may get infected and be able to pass it on to someone who's vulnerable. And so right now, probably for 6 months after the vaccine is deployed, people will still need to be wearing masks.
Have anything else you want to add, or any?
Yeah, the good thing, what's interesting in the last few months is that with we've actually gone sort of at lightning speed in terms of developing treatments for this virus. traditionally it took years to develop treatments, and so we actually in the last in the last 2 weeks, we've in our own county, in Rush County, we've started getting the monoclonal antibodies. And the monoclonal antibodies, what we're finding is that if you're early in the infection, if you're in the first 7 to 10 days of the infection, especially if you're at high risk, we give you the antibodies. It's an infusion through an IV, so we got to put a needle in your vein to give them to you. Right. But it actually turns it appears to like turn the disease off. These folks that come in pretty sick in that first week. If we give them the monoclonal antibodies, it turns it off, and they're usually better in a few days. And so that technology is very similar to the technology that they've used to make the vaccine, and that's why I say the vaccine is basically making your body make antibodies. Okay. That are very similar to what we give as medicines. And that's an argument for doing, we've had a hard time getting folks who want to get tested because they don't want to quarantine, but people at risk, early testing will help a lot because we have to, these monoclonal antibodies, we actually have a treatment. Most viruses we don't have good treatments for, but this treatment appears to be very effective for folks that are at risk of getting serious disease.
So you think that this vaccine is, I guess, as safe as and reliable as all the other vaccines we have, like even for the modern day flu? Or
it's definitely more effective than the flu. The flu vaccine is not. It's about 50 to 60% effective any given year, but if you take the flu shot yearly, it has you have a better immune response, and your flu is less severe. This vaccine, we really don't know how long it's going to last because it is brand new. But in general, most folks with these types of viruses, I anticipate the immunity will probably last 1 to 2 years. Okay. And so we may have to do a booster in a year or two, depending on the severity of the illness.
Okay. And do you believe that with the vaccine when it does become public, do you think that we will see a decline in COVID cases? And
yeah, we need about 70% to 80% of the population get vaccinated or have COVID. Okay. And so right now, there are about 60% of us, even in healthcare workers, about 60% of healthcare workers are willing to take the vaccine. 20% are on the fence in that they're uncertain because it is brand new whether they want to try it. And then about 20% are totally against it. But if we can, my thought is that I always look at the pros and the cons. There's always a risk and a benefit, but I see a lot of benefit to the vaccine, so I'm willing to be the first ones to get it.
Right.
And as we get more healthcare workers immunized and people see that it's safe, I think the other 20% will jump on board.
Right. And if to somebody that were, like you said, on the fence about getting the vaccine, what would you, from a doctor's standpoint and having all this background, what would you say to them to try to reassure them that?
I always, because I've seen such a good response to these monoclonal antibodies that we've been giving, I looked at how the vaccine's made in terms it is novel, it's a brand new type of technology that they're using. Well, when I say new, the technology has taken 30 years to develop. The technology they've used to make this vaccine has been in the making, in the science and all that. It's taken 30 years to develop this technology. It's actually technology they use for cancer research, but the way they use it, it's basically stimulating your body to make monoclonal antibodies. And so given how effective the infusions we've been given these last few weeks, the vaccine should be incredibly safe and effective.
Oh, awesome.
The other thing I look at too is, again, risk-benefit. If I was your age and healthy, I wasn't around a lot of older folks, then I would say, hey, let's get the older folks and people at risk first vaccinated, and then you're going to see those folks do fine with the vaccine. Then I would consider giving you the vaccine. Okay. But we also look at if you're over 60, if you're diabetic, have any sort of lung disease or kidney disease or heart disease, you're an incredibly high risk. And when you weigh the risk benefit, you're going to get a lot of benefit from the vaccine and have very little risk.
Yeah. So would you say you would recommend the vaccine to anybody
Yeah. In order to stop the pandemic, we have to get that 70%, which means we're going to have to immunize. We're going to have to immunize folks that are 18 and above too, because they are the ones that will tend to want to spread it. Okay. Because the hard part with this illness is that most of us don't get that sick, but you're able to spread it to people who will get very sick.